We want to direct our attention now to mental health and mental disorders in our criminal justice systems and law enforcement. And our next three guests are passionate about the topic.
Boone County Sheriff Mike Nielsen's jail has gone from not offering any mental health services to offering more than 100 hours a week.
Psychiatrist Dr. Ashley Overlay is the CEO of Sandra Eskenazi Mental Health Center. Her clinicians team up with IMPD officers and detectives and interact directly with those in the middle of mental health crises.
And Sergeant Lance Dardeen. Sergeant Dardeen is the supervisor of IMPD's behavioral unit. His officers are partnered with a clinician before, sometimes after, someone experiences a mental health crisis involving police. Good morning to the three of you. Ashley, I'm going to start and jump right in with you to get this conversation started. Can you tell us about the Assessment and Intervention Center and how Eskenazi and your team members are involved?
Sure, I can. Thank you. It's a pleasure to have the chance to speak with you this morning. The Assessment and Intervention Center is part of Mayor Joe Hogsett's criminal justice reform efforts. The AIC, as we call it for short, is a program of the city's Office of Public Health and Safety, and it is staffed by Sandra Eskenazi Mental Health Center staff. The AIC provides safe temporary housing and assessment and referral to appropriate community resources. It's located in the Twin Air neighborhood, and it's on the site of the new Community Justice Campus. The AIC really is a new kind of resource for our community. It's something that can serve as an alternative to jail or hospital for people who are an appropriate level of care for that setting. And it's in a location where people can receive a mental health assessment and then connection to community resources. Often when people are in a crisis, then they simply don't know where to turn. And they might need help setting goals. They might need information about what kinds of resources are available. And the AIC can assist with these goals in a safe setting. The AIC receives voluntary referrals 24/7 from a wide variety of community settings, including self-referrals. We provide mental health assessments, referrals to treatment, and temporary housing and basic substance use withdrawal management. We provide skills training and also peer support from individuals who have their own experiences of recovery from mental illness, and can share that experience and support and encouragement with others who need it. And so we are really proud to be part of the Assessment and Intervention Center,
right.
And really excited to see this develop over time with the city.
Sergeant Dardeen, we want to bring you in on the conversation right now. We hear so much about defunding police and reimagining police. They are controversial and hot button phrases, but Indianapolis is adding more staff and teaming police with licensed clinicians already. Tell us about this behavioral unit.
So the behavioral health unit started in 2016, and we partnered up with clinicians from the Sandra Eskenazi Mental Health Center. And our goal initially was to follow up on hospitalizations that street officers were doing in hopes of trying to get those individuals connected to the most appropriate resources after the emergency. And we really tried to dig deep on what was the cause of that hospitalization. And we found that usually it's stress related. So our clinicians do a great job of getting in there and finding out what the root cause of the problem is. And then we can take our time and try to get these individuals connected because these cases can be very complicated. And what we found is over the years, we've had people that we're still helping get into treatment and maintain recovery. And this is, 2021. And we're still helping people that we helped in 2016.
Yeah, Lance, it was amazing to me to be starting to talk about this conversation and people not understand that these units have been around for years. And we're going to talk about that more after we take a commercial break in about 2 minutes. But before we do that, Sheriff Nielsen, I have about another minute and a half before we do that. I know you're personally affected by mental health. We've shared a little bit about that here on Fox before, your personal story. I just wanted to ask you a little bit to share that as people get to know you more and why this is so on the forefront of what you do.
Yeah, you know, as a law enforcement officer of 38 years, we were told many years ago, you just kind of put the things that you see in the back of your mind and you never deal with those again. Well, I have learned over the last 5 years through my personal experience, starting off with the Gill family double homicide in Zionsville in 2016, where my daughter was a crime scene investigator there, and that moved into October of 2016, where she attempted to take her life because of the things that she saw on her job. And then losing Deputy Pickett and another friend to suicide within a couple days, and a local teenager here in a car accident all within a couple days really heightened my awareness that I need to personally take this serious and make sure that my people and my staff are okay. Well, at the same time, we see the same gammon inside our jail facilities, where we are becoming the pseudo mental health facilities in the state, and we have to change that culture. And I applaud IMPD and Eskenazi for the teamwork that they're doing to try to keep those folks out of our jails. So I've seen it from the personal journey all the way into this side of things when it comes to jail incarceration.
Sheriff Nielsen, we're going to hold right there, pause. We do have to take a break because we have to pay the bills. We're going to come right back after this 2.5-minute break and pick up right where the three of you are right after this.